Hey everyone, I'm Dr. Caplan. Today we're diving into part 2 of our series on gender differences in cannabis use. This is a longer form video. I sent out a chopped up version of this across other socials if you want to check that out. If you're just joining us and you're thinking, hey, cannabis affects men and women differently, then buckle up. That's precisely what we're getting into here. We'll explore the fascinating effects of cannabis across genders, the good, the bad, the still uncertain. Plus, stick around for the latter half where we'll cover the hold on a minute section where I'll talk about some important caveats and sobering facts about this green herb. Starting off, the good side for women. Women generally get more intense highs. Experimental research suggests that women may experience a more intense high than men at equivalent doses. It's like women got Mother Nature's 2-for-1 deal, and men did not. Medicinal benefits. Women report generally greater relief from symptoms of conditions like multiple sclerosis and fibromyalgia when they use cannabis. The downside for women, memory and paranoia. Some studies suggest that adverse effects like memory impairment and paranoia may hit women harder. Munchies alert, ladies. You might also find yourself reaching for the snack cupboard a bit more than the gents. The bad side for men, cannabis-induced psychosis. Men are at higher risk for severe mental complications like cannabis-induced psychosis than women, at least according to a couple studies from the mid-2010s. The good side for men, easier withdrawal. Clinical studies suggest that men may experience less severe withdrawal symptoms than women, making it somewhat easier to quit or reduce their use. Now, to cover the complex web of hormones and endocannabinoids, estrogen and other hormones interact with the endocannabinoid system, possibly affecting how women experience cannabis differently than men. It's like the female body has its own built-in cannabis mixer, and it's still figuring out the best cannabis cocktail recipe. A quick note on gender fluidity and respect. Before we move on, let's pause and tip our hats to the evolving understanding of gender itself. It's 2023, and we know that gender is not a binary concept. It's a spectrum. And while most studies still frame their findings in terms of men and women, we recognize and respect all gender identities. That means that the cannabis experience for non-binary, genderqueer, gender fluid individuals may be a unique blend, a sort of cannabis cocktail, if you will, that deserves its own set of research. So let's be clear, everyone deserves respect and individualized care, no matter where they fall on the gender spectrum. So now the sort of hold on a minute, important caveats. Research is preliminary. Gender-specific effects are still being studied. Take what you hear here with a grain of, let's say, keef. Individual differences are important. One's genetics, health, and lifestyle play important roles too. So your mileage may vary. Strain and dosage. Different strokes for different folks and different doses for different genders, perhaps. Dependency risks. Both genders can become dependent, so moderation is key. Talk to your doctor. Always consult with a healthcare provider before you're using a medicine, and cannabis is a medicine, and a treatment for any condition deserves respect. Legal and pregnancy considerations, just know the laws, and if you're pregnant or breastfeeding, the official line is just avoid it. Summary here, in a nutshell, cannabis does not discriminate. It has both good and bad effects for men and women, but the scales tip slightly differently depending on your chromosomes. However, remember that individual experiences vary and that ongoing research keeps updating what we know. So keep your ears and your lungs open for more updates in the future. Thank you for joining me in this enlightening journey across the highs and lows of cannabis use for both genders and gender fluids. If you enjoyed the video, don't forget to like, subscribe, and share for more cannabis education. This is Dr. Caplan signing off. Stay curious, everyone.